Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Today let's learn about the determination of the race and the sex of the individual. So to begin with, let's look at how to determine the sex of the individual. The sex of the individual is determined by there is something known as the medullary index. So what is the medullary index? It means the diameter of the medulla by the diameter of the whole bone into 100. So here medullary index, it is simple to understand. Next we look at the sciatic notch. The sciatic notch index, it deals with the width of the notch by the depth of the notch. So medullary is concerned with the diameter. So this is nothing but the diameter. The sciatic notch is where the width of the notch by the depth of the notch. So next what do we have? The next is the Washburn ischiopubic index. So this Washburn ischiopubic index, it involves the pubic length by the ischial length. So it is Washburn IP index. So ischiopubic index. So this was dealing with the pubic length by the ischial length into 100. Next we look at the corporobasal sacral index. This is the breadth of the first sacral vertebra by the breadth of the base of the sacrum. Next is the something known as the sternal index. Sternal index means the manubrial length by the body length. So sternal index means the manubrial length by the body length. Manubrial length divided by the body length. So we spoke about the medullary index, the sciatic index, the Washburn index, the corporobasal index and the sternal index. Next is we move on to the accuracy in case of identifying a skeletal remain. So this is known as nothing but the Krogman. So this is nothing but the Krogman. The Krogman's degree of accuracy. So under this, there is, in terms of looking at the entire skeleton, it amounts to about 100%. And then looking at the pelvis bone, it is about 95%. So pelvis, this is important, pelvis amounts to 95%, and then followed by the skull. The skull amounts to about 90%. And then the pelvis and the skull, it amounts to 98%. So 98% is where the pelvis and the skull are used for the determination. The next is the long bones. The long bones, if you see, it amounts to just 80% of the total. Now let's move on to finding the race. So how is the race of the individual? The race of the individual is determined by the B. Let's go alphabetically. There is a B. B stands for the brachial index. So what do you mean by brachial index? So brachial index, it refers to the length of the radius by the length of the humerus. It is R and H. So you have the radius and the humerus is where we are comparing, and this is the length. Next we move on to the cephalic index. So what is the cephalic index? The cephalic index is where the maximum breadth of the skull divided by the maximum length of the skull. So breadth by the length. Next is we move on to the crural index. Crural. The crural index is nothing but the length of the tibia by the length of the femur. Length of the tibia by the length of the femur. In brachial, it was the radius and the humerus. So we are in RH, and crural it is the tibia and the femur, that is TF. And all this is multiplied by 100 so that we get a percentage. So next is the humerofemoral index. It means basically the humor by the femur, as the name suggests. And then the intermembrane index. Intermembrane index is basically the length of the humerus plus the length of the radius divided. So it is the intermembral. So the intermembral index. So what is the intermembral index? Intermembral index is basically the length of the humerus plus the length of the radius divided by the length of the femur by the length of the tibia. It is easier to remember because the top part of the body is where the numerator and the bottom, that is leg, is associated with the denominator. To learn and grow daily like this, please do subscribe.